Hello, today I'm going to explain to you the overdenture, especially the tooth-supported one. So we have here, to begin with the overdenture on a patient, is we have to do the patient selection first. That means we have to look at the medical history, at the oral hygiene, and at the motivation. Because patients do come one time and they don't come at all. So, and plus, you have to recall them frequently for a fluoride application. And for an overdenture, you have to look for enough interarch space to do an overdenture. Secondly, you have the abutment selection. The abutment selection depends on the position, the number of abutments, the periodontal evaluation, the endodontic evaluation, and the decay or previous restorations. I will talk about the points right now after a few minutes. So the factors to be considered to do an overdenture are the cost, the abutment condition, and the high risk of caries, if there's any risk caries or not. So now, at first, the abutment design. We have mainly three types of designs. We have here the simple tooth reduction within enamel. This is done only in anodontia. Secondly, we have the thimble tooth reduction. It is like this in this shape. It is barely done due to when we have due to long abutments, which leads with lateral forces by overdenture, and we have to have enough interarch distance. The third type, this is here the first, second, and third type. We have abutments which are endodontically treated with a dome shape on it. We have here three types. We have an endodontically treated tooth with an amalgam plug on it, but this leads to caries. Or we have an endotooth with core and coping, which can protect the tooth from caries. Or we have an attachment on it, which is the best because we have here enough interarch distance. But all these three lead to decrease retention. Okay, so to begin with, the first point of the abutment selection is the position and number of abutments, the first and second point. So ideally to have are 4 abutments, 1 in each quadrant. The best abutments are canine and the first molars. Why canine? Because canine has a canine eminence and it resists anterior-posterior lateral forces, and it has good stability. And first molars is widely separated. Both of them give a good stability. As I said, the best one, I only like 1 in each quadrant. And very, very important is that the abutments must be away from each other. Okay? What are the contraindications of using abutments? When we have abutments which are when we have 2 neighboring abutments, example the canine and the premolar, avoid using the 2 neighboring abutments. Why? Because it leads to bulging of the gingiva. Therefore, use only one of them, and caries can start and between these 2 abutments because there's a narrow area. So use one. The best thing is to use 3 separate abutments or 2 separate abutments, or even 1 tooth with an implant on the other side. Please do not connect the implant with the natural teeth. Okay, so canines, which are better, only canines, than the premolars. Molars are good also. These are the ideal one. So we have here the second factor is the periodontal condition and mobility status. This is like the third point to talk about the abutment selection. This one here. So what are the periodontal conditions? We cannot use an overdenture, or we cannot use an abutment if we have a mobility of grade 3. The tooth is then indicated for extraction. If we have a grade 1 or 2, they're improved by reduction of the crown root ratio. We have to have a bone support of 6 millimeters. And a good healthy gingiva, good marginal gingiva around the abutment, no pocket, no bone resorption. That means we have to have a proper emergence profile, like concentrate on the contour of gingiva, and a good oral hygiene is very important. Okay, the fourth point for the abutment selection is the endodontic potential and prosthetic status. Many abutments are endodontically treated, but if we have a single rooted teeth with single canal, they are easier to treat. Okay, the fifth one is restorative condition. Many abutments or many teeth are do have caries, so coping is preferred, of course. We have to look at previous restorations on the abutments before doing the overdenture, and look at the crown lengthening, because some have a long crown root ratio, which have to be reduced before doing the overdenture. And very, very important is, if we have no enough inter-arch distance, we cannot do any overdenture. So there is like an attachment kind, this is a locator attachment, where the abutment is like a socket, and the fitting surface is like a capsule. And this we have like here no lever arm. But the disadvantage of locator attachments is that it might cause foot impaction, but they're used in limited inter-arch distance. So this is like a good advantage. If you have an limited inter-arch distance, use the locator attachment between the overdenture, with the fitting surface and the socket. The clinical procedures of the abutment. At first, you do the abutment preparation. You look if you do abutment preparation without endodontics, without endo treatment, or with endo treatment. And at first you do the endo treatment, then you do the preparation of the root canal treatment. Okay, it has to be like dome shaped, 1 to 2 millimeters thick. Then you do the primary impression with alginate, of course. You do the study cast with special tray, and then the secondary impression with rubber base. You know it, of course, from the practical courses. Then you do the master cast. And when you do the master cast, in case of amalgam plug, you do an occlusion block with a bite, and then the try-in and the patient and the delivery. Okay. In case of coping, you do the coping and wax to get the metal. Then you put the metal coping on the patient's mouth, and you do the secondary impression with it. Okay. I already said here secondary impression, so you do here a secondary impression again with the metal coping. Then you do the bite, try-in, and delivery. Okay. What does try-in means? Try-in means you look at the fitting surface of the tridenture. You look for stability. You check the vertical dimension. You check the occlusion. And in case of attachment, You do here the study cast and special tray. And then in case of attachment is you do cement the attachment on the tooth. So you can see it on the fitting surface. And after you cement it, then you do the secondary impression. So here in case of attachment and coping, you put the material on it. Then you do the secondary impression. Then the bite, try-in, and delivery. And then you can cement the attachment part in the denture, of course. So because the attachment part has like two parts, one on the abutment and one in the denture and the fitting surface. So actually that's it. This is like a short summary of the tooth-supported overdenture. Very, very important is the abutment selection. Yeah, I hope you understood it. And if you have any question, please write it down in the comments. And don't forget to subscribe. And I will see you in the next video. Bye-bye.